So most important in angioplasty, the fundamental equipment is the first and foremost is the, after acquirement of the acquisition of the vascular access, the guiding catheter, which is the basic equipment in the first step during the angioplasty. And the most important here it is after engagement of the coronary ostium, the opacification you can accomplish by means of the guiding catheter. And the most important is the power with which it will give support for advancement of the next steps, that is passing the guide wire as well as passing the balloon and deployment of the stent. So for all these, the guiding catheter is most important. So for this, some of the fundamental aspects I have to discuss, and what are the important tips and tricks for engagement as well as accomplishment of the angioplasty. As we know, like artery, guiding catheter is made up of 3 layers. The innermost layer is a lubricious PTFE coated inner layer. This is most important. And second most important is a middle layer, which is a stainless steel braid for increased strength. This is most important. This layer ultimately determines the stiffness of the guiding catheter. As the size of the guiding catheter is increasing, it becomes more and more stiffer, and it will vary from company to company. I will discuss in the later slides. And the outer layer is a soft nylon elastomer jacket, which ultimately determines as long as the guiding catheter is inner with lubricated with the blood, the stiffness slowly will decrease. And the stiffness is most important for giving support, which is most important in accomplishing of complex angioplasties, like while passing devices during complex angioplasties, especially CTOs, bifurcations, left main interventions. So the ultimate functions of the guiding catheter is adequate opacification of the for accomplishments of angioplasty. Second most important function is giving a support, either by means of active or a passive support, or by means of stiffness it will giving support, so that we can deliver the wires, balloons and stents accurately at the site where we have to repair. So before that, as we know, the most common types of the catheters are Judkin's catheter, with which we are all acquainted. For this, as we know, the left or right, there is 2 curves, primary curve and secondary curve. Primary curve is important in engaging the ostium. The secondary curve is most important here to give the support and coaxial alignment. So the sizes available are 3, 3.5, 4 and 4.5, everybody knows. This is the fundamental difference between the, I will also discuss regarding the diagnostic while discussing guiding, so that we can appreciate the difference and the fundamental concepts we can observe. The basic difference between diagnostic guiding catheter is the inner lumen as well as the layers. Inner lumen for the diagnostic catheter is small compared to the guiding catheters. As we know, now the radial angioplasties are more and more familiar, as well as it is becoming increasing in the incidence. So most of the simple angioplasties, especially de novo stenting, discrete lesions, you can perform by means of a 5 French guiding catheter, which the Thermo company is making. And as we know, the routine angioplasties we will perform by means of 6 French catheter, either by radial route or by femoral route. And all complex angioplasties, including the left main, graft interventions and the chronic total occlusions and bifurcations, usually a small percentage, and 7 French as well as calcific lesions by rotablation, always better to take a large size guiding catheter, that is 7 French. So just before going, I have brief regarding our routine angiograms and angioplasty. As we know, we are familiar with the Judkin catheter because of its preformed shape. Either by means of femoral route or by means of radial route, we can engage both left coronary artery as well as right coronary artery. What is that? Sorry, can we go to that one back slide? not working here. 1 minute, I am going. It is not working, the pointer. Yes. Yeah. Yes. So, as we know, either by radial route or femoral route, we will routinely take, because of preformed shape, left coronary artery is very easy to engage, whereas for right coronary it needs manipulation. For femoral, we will pull back and give the clockwise torque to engage the right coronary artery, whereas for in the radial route, while pushing, you can engage by giving clockwise route from left coronary artery. So also Judkins right. And the most important, the commonest workhorse diagnostic catheter during radial angiograms is multipurpose curve, that is a Tiger catheter. Because of the multipurpose nature, it can engage both left coronary artery as well as right coronary artery with minimal manipulations. That only we should be cautious when you are engaging right coronary artery. Because of its multipurpose nature, it has a tendency for deep engagement. So you should have a very good control during torque, as well as slightly pulling movement you should do, so that it won't engage deeply and produce catheter-induced dissections. And especially if the anterior take of right coronary artery, the appropriate, you can choose the Amplage left catheter for engaging the right coronary artery. As we know, the variety of catheters available for the grafts, venous grafts as a Lima, out of all, the most commonly we use the Judkins right of 3.514, and sometimes we can use Amplage because of its anomalous, that is, because anterolaterally the proximal anastomotic sites will be there for the venous grafts, and sometimes for SVG to right coronary artery, it is vertically placed. So multi-purpose usually we will choose. And these are the venous grafts. For all venous grafts, we can use Judkins right. For right coronary artery graft, because of its vertical orientation, multi-purpose catheter usually we use. For all venous grafts, you can use Amplage also if we find difficulty with Judkins right. And for left internal memory artery, usually the Lima catheter, because of its pointed angulation tip, we can use. And of course, Judkins right catheter also we use. If we find difficulty with Judkins right, we will shift to the internal memory artery catheter. So these are the commonly used. For radial, we use the Tiger catheter for both right and left left JL 3.5 and JR 3.5, JL 3.4, and for right JR 3.5 and 4. And for femoral route, as we know, the Judkins is the workhorse catheter, and other catheters, Amplage we use if Judkins find difficulty or anomalous surgery of the coronary arteries. So now most important is the guiding. So as we know, there are so many varieties of shapes are available in guiding catheters, but most commonly what we use, just I will discuss. As we know, just like a fit and misfit like, for accomplishment of successful angioplasty, the guiding catheter choosing is important, so that we should have a orientation regarding the routine guiding catheter which we use. So these are the families of the guiding catheters which we commonly use. The first most important is the Judkins left, and for right side Judkins right, and next is the Tiger family, but this is less commonly used, and unless you have a very well acquaintance, the only advantage of this is the hydrophilic nature, and with minimal manipulations you can engage the coronary ostia. And the most commonly used, even rather than Judkins in radial route as a femoral, is extra backup catheters. Of course, various catheters we use from various companies, and Vista Bright for Cardis company, and the EBU catheter from Medtronic, and the Match or Oda from the Boston Scientific company. And of course, apart from these, Amplage families also we can take, especially if the extra backup support is much more needed apart from EBU, and any finding difficulties, especially for circumflex angioplasty or uptake of the right coronary artery, I will discuss. This Amplage will usually choose. So this is the most important. Actually, the guiding catheters varies depending upon that steel braided structure, the middle layer. The first one is the soft guiding catheters, which they will engage by means of active manipulations, so that you can coaxial align with the coronaries, so that it will give support. Out of this, the match one, that is Boston Scientific catheters are relatively soft catheters, and then Juma also. These catheters are relatively soft, as well as Judkins family also. Next important is balanced. Here the steel braid layer, it is a balanced one. Both proximally is more stiffer and distally it is relatively soft, so that it is atraumatic to the coronary ostia, out of which the Vistabrite and launcher will come in this family. And the third important is the passive support from the opposite wall of the aorta, and these are relatively stiff, and under which the Juma catheter, especially if you need much more support, then Juma catheter is the catheter of choice, so that you can accomplish the complex angioplasties with, you can take the passive support from the aortic wall. And 5 French guiding catheter, especially Termo company is the one which more available along with the Cardis. It is a hard trail, that is Termo, and Vistabrite or Bright Tip from the Cardis company. Of course, the common 6 French is the common catheters will usually use, that is launcher. There is a Medtronic company, the inner lumen is 0.071. So this is useful for accomplishing of certain steps, which I will discuss in the next slides. And of course, 0.070 is a Vistabrite, that is Cardis, and match, and then as well as Voda also, which comes under Boston Scientific company. So this is a common thing through radial route. If you take this extra backup catheters, it will give support to the advancing devices like wires, as well as the catheters, micro catheters, or these rotablator by means of 2 steps. One is by means of coaxial alignment to the coronary ostia, and second one is a passive support from the opposite wall of the, this one is that pointer, from opposite wall of the aorta. If you can take the inner and outer, the outer surface of the aorta, it is taking the passive support, the secondary curve. By means of coaxial alignment, it gives the active support. With these two, we can accomplish even complex angioplasties. So extra backup catheters are preferable when you are using radial route, because unlike femoral, where the secondary curve, already preformed secondary curve, it gives support from the aorta. But for radial, always you have to choose extra backup catheters. Yes. Extra backup catheter like this. So for radial route, this is most important. That's why always extra backup catheters are useful for accomplishment of completing the angioplasty. For women, usually we will take less size. For men, we take higher size. And Judkin, of course, this by means of alignment, it will give the support. If you push sometimes, if the favorable coronary anatomy is there, it will give the backup from the opposite wall. And sometimes this is called amplification. This is called. Whenever you push, and it will give extra backup support, like this is called amplification of the Judkins catheter. Sometimes you have to do in radial right coronary angioplasty by means of radial route. Of course, this is routinely we use for a routine simple angioplasty. You can take the Judkins left curve, which is a preformed by means of coaxial element as well as secondary curve from the opposite aorta. You can finish for a routine simple angioplasties. And this is most important, especially upsloping or sometimes Shepard crook, right coronary artery, we can encounter where routine Judkin won't give support, because of if it's you have to engage by means of opposite aorta, it won't give any support. So then you have to take these amplage. This gives a very good support for accomplishment of the either simple as well as complex angioplasties in anomalous RCAs or uptaking RCA or Shepard crook right coronary artery. And of course, these guiding catheters, the Judkins, you can use the guiding catheter radial route, but only it increases the coaxial alignment, but it won't give support when compared to the extra backup catheters, it gives left support. So all complex angioplasties, these Judkins may not be useful by radial route. Of course, for venous grafts, these are gross guidelines. For right coronary artery venous graft, either Judkins right or a multi-purpose catheter we can take, which gives support for filter devices also. And for LAD venous grafts, the Judkins Wright or Amplage give the support, and for OM venous grafts, either Judkin or Amplage we can take. And of course for the Lima, either Judkins Wright or internal memory artery, the guiding catheter, for it will give the support for completing the angioplasties. Of course this is most important, the slide in selection of our procedure and planning which guiding catheter you have to select for completing the angioplasty. For a simple de novo stenting lesion, discrete lesion, solitary lesion, you take 5 French for simple angioplasties, guiding catheters. And then the routine catheters, routine angioplasty 6 French, and especially this is useful compatible with thrombectomy devices like export, and as well as also just image IVUS guided technique, you can use the 6 French catheter. And kissing balloon also, it will allow 2 balloons because of inner lumen diameter of 0.071. This will allow 2 balloons for kissing balloon, but it won't allow 2 stents. This is most important. Whenever in bifurcation strategy, if SKS technique 2 stents you have to simultaneously pass, means you should not choose 6 French catheter, because otherwise it becomes difficult. You have to choose higher size. For a simple crossover technique and final kissing balloon, 6 French is compatible. And then rotablator of less size, that is 0.25 bar and 1.5 bar, it is compatible, that 6 French. As well as distal protection devices also, 6 French with wide inner lumen diameter of 0.07 catheters you can choose, but less inner diameter 6 French guiding catheters, it becomes incompatible. So whenever the accessory devices or adjuvant devices you are planning in your angioplasties, always better to take 7 French angioplasties, where you can comfortably deliver 2 stents simultaneously, and rotablator of higher sizes if it is needed, upsizing bar during calcific lesion angioplasty, as well as especially during chronic total occlusions, various devices you have to use simultaneously. For example, you have to use Corsair, or you have to use the trapping device by means of passing a balloon also simultaneously. With that 6 French may not be compatible. You have to always to take 7 French for completion of the various devices if you use during your procedure. So before planning which guiding catheter, you yourself should question whether it is a simple or whether you have to use adjuvant devices, or there are tortuosities where the support is needed. So with these questions, you have to choose whether 5 French guiding catheter or 6 French or 7 French guiding catheter. Of course, summarizing diagnostic, 5 French, 6 French usually we take, and radial the workhorse catheter, that is Tiger. For femoral, Judkins left and right. For guiding catheter, for left commonly we use extra gap backup catheter 3, 3.5 and 4, and right Judkins as well as AL1 Amplage. For vein graft, Judkins and Amplage and multi-purpose. For Lima, internal memory guiding catheter. Of course, for routine angioplasty 6 French, and for complex angioplasty 7 French. The Cardis, that is Vista Bright, Medtronic, that is Launcher, Boston Scientific, Voda and Match catheters. So summarizing simple, last 1 minute. And always advancing and torque of the guiding catheter should be gentle and gradual, so that it should not produce a guiding catheter induced dissections. And any difficult engagement you have to change to different size and shape. Always avoid deep cannulation, and only small size guiding catheters you can sometimes manipulate, right coronary catheter, deeply cannulate for passing the stents. And whenever there is a damping is there of the pressure curve, it indicates obstruction to flow. We should not, it indicates no coaxial alignment or diseased ostium. We should not inject the contrast. If you inject, means it will be fatal dissections and arrhythmias and hypotension. So whenever damping is there, always you see the pressure curve, and you have to say take the side holes or you downsize the guiding catheter so that damping will disappear. With this I will finish my guiding catheter basic anatomy and important manipulations and choosing. Thank you for attention.
Thank you so much, sir.